Here to separate fact from fiction. First of all, what's wrong with his eyes?
Well, it's a classic infection. He's got pink eye. You know, it normally starts in one eye and spreads to the other. Lots of swelling, tearing, and redness.
Is that because he was rubbing one eye and then working over to the other, or is it it's just one of those things that spreads quick?
Well, it depends upon the cause. It can spread quick if it's a viral infection. That's real common. And it does spread. It's very contagious. So you don't want to rub your one eye and then rub the other.
So let's talk about if you've got the sort of the initial indication that you've got an eye infection, what you need to immediately do to try to take care of it.
Well, the first thing you want to do is stay home from work or school. You don't want to spread it to others. Go see your eye doctor and find out what type of infection you have. We can give you eye drops for a bacterial infection, but if it's a virus, it's just got to run its course.
How long will that take? Because he's gone. He's off the air now.
It can take 2 weeks.
Wow.
You may be infectious for about 10 days to 2 weeks.
Really? And so, and the drops will clear it up eventually?
Well, not if it's a virus. We just treat the symptoms. It has to just run its course, kind of like the flu.
Wow.
Most of us just stay home, have to take care of it.
Yeah.
So imagine he's done for the Olympics this year. That's a big hit for those guys, Bob Costas. Hey, let's talk some more here. Alpine skier Bode Miller has recently came out and said he needs LASIK eye surgery, and he regrets not having it before the Olympics. What's up with that?
Yeah, well, some athletes think that it actually helps their performance, gave them confidence. And Bode, it was the other. He didn't have the time to get LASIK, and he felt that his vision hindered his performance.
What's the downtime for LASIK?
Well, the downtime, really very little.
Okay.
Have it on a Friday, go back to work on Monday. It's that easy.
Aren't there's two types now, right? You can do the LASIK and then the other, what's the other type?
Right. Well, we have lots of different procedures. There's the surface procedure known as advanced surface ablation. LASIK, we have implantable lenses. We've got lots of vision correction options for you. And for an athlete that's been training for months and months, this one race, they don't want to have a problem with their contact lenses or their eyes. That's their life. That one race they've been training years for.
To have him say something like that is a huge deal, yeah. Oh, wow. So advice to the athletes, if they're thinking about getting something like this, should they jump into it or ask you questions first? What should they do?
Well, I give the same advice to athletes that I give to members of the military, law enforcement, and mere mortals like us, okay? And that's that the technology wavefront guided LASIK today is as individual, the treatment, as our fingerprint. For athletes, each athlete has a particular challenge, but it can increase their confidence and give them one less thing to think about.
What are you talking about price-wise usually?
Well, the price is affordable for everyone. We've got lots of financing programs and options, less than a cup of coffee a day.
Really?
Very affordable.
What's the total price if you want to get LASIK?
You know, I don't even know, but what's the cost of your vision? You know, it's pennies a day to get wonderful vision for your lifetime.
Dr. Feldman, thank you for being here. We really appreciate it. For more information on LASIK or to get a hold of Dr. Feldman, all you have to do is go to fox5sandiego.com and click on that little Scene On tab.
I need to ask the doc a question.
Uh-oh.
Can I ask you real quick? When I wake up from my nap in the afternoon, if you can answer this real quick, I'd appreciate it. I wake up and my eyes are fuzzy for like half an hour to an hour. Any reason behind that, or should I come see you? I'll just come see you. I do
You
it.
need to come in and we need to find out what it is.
Do you have contacts?
No, I don't. I have
No,
no vision problems
because mine
at all.
do that if I sleep in my contacts.
Yeah,
but if I don't have them in there, that's interesting.
It's
For
like,
30 minutes.
I'm constantly
lots of
working my eyes to try and
Yeah.
pick up my son right after I do that. So I'm like, oh wow, when I'm driving. So
Yeah,
I'll come see
there's
you.
lots of different things. Even these lights are pretty bright on you.
Yes, they are.
All right, thank you so much.